Well, I think people who have permanent atrial fibrillation, it's important to deal with a couple of things. The first is to see what they feel like, how they are, their symptoms, and ensuring that we can treat their symptoms to make them feel better. The second question that's often very important is around risk of stroke, because we know there's a clear association of AF with stroke. And so we use a scoring system called CHADS-VASc, and we try and risk assess their score of a stroke. And if it's high, we start them onto medication, blood thinning medication. So arrhythmias are very common is the first thing to say, and there are a number of treatments available for arrhythmias. Drugs can certainly help, and arrhythmias come in different types. So there are types of arrhythmias called SVTs, and atrial fibrillation is probably the commonest arrhythmia. In terms of SVTs, drugs again can help, but nowadays I would say that ablation treatment, which is a procedure performed under local anesthetic, takes a few hours, done as a day case, is probably first-line treatment for most SVTs. Atrial fibrillation can be treated with drugs also, and usually drugs are first-line in most people. But again, where drugs don't work, there is a procedure called an ablation, an AF ablation, that might be relevant for those patients. And again, those procedures are increasingly being done as day cases, a little bit more involved, carry a little bit more risk, but not much more. And they can often help to improve quality of life and symptoms in those patients. Well, I think pulse check is very, very important because we know that certain arrhythmias, atrial fibrillation particularly, can often be asymptomatic, so patients don't even know they've got it. And the problem with having atrial fibrillation that is not diagnosed is that it can predispose you at certain risk, particularly risk of stroke. So if you're above 65, particularly if you have other conditions like high blood pressure and diabetes, then actually you should be on blood thinning medication, because we know that atrial fibrillation can predispose to stroke. So if you check your pulse, or if your GP is able to check your pulse and feel whether it's regular or irregular, that can then prompt the GP to do an ECG, which is a heart tracing, an electrocardiogram. And the ECG can then diagnose whether the patient's got atrial fibrillation, and that's of course important in establishing a diagnosis.